makeup on my face, so I wanted to make a video really quickly while I am still presentable. I'm in the bathroom. I'm about to wash off my face. So let's just get straight into this video. The title is most likely going to be what to expect when you get to the labor and delivery unit. So for those of you who do not know, I am a labor and delivery nurse, and I always find that women are super shocked and surprised at some of the common things that will happen once you get to labor and delivery. Number one thing that I would warn you to do, as long as you're not scheduled to have any procedures or your doctor has not beforehand told you not to do this, would be to eat. Once you get to labor and delivery, you will most likely be restricted from eating meals, heavy meals. Most likely you'll probably only be able to eat ice. We call it little ice chips that you'll just kind of be able to chew on, suck on throughout your labor, but they restrict you from eating food and also drinking fluids because of the risk for choking in the event of an emergency if we have to take you back for a C-section. So that's pretty much the reason why they restrict you from eating. Is all as a precaution in the event that you do have to go back for emergency surgery. They want your stomach to be clear for at least, I believe it's something like 6 to 8 hours. So it's as a precaution. So yeah, a lot of women complain that they're super hungry and they haven't eaten in hours, which I always feel super terrible telling them that they can't eat, they can only have ice. So that's definitely something that you might want to consider before coming to the hospital, is making sure that you get something on your stomach. Another thing is that you're going to get an IV, most likely. Most women, because we don't let you eat or drink, we're going to be starting an IV on you to give you fluids and keep you hydrated throughout your labor, and also, you know, just in case we need to give you any medications while you're there, we would have an IV access there and ready. So some people don't know that this is going to happen. Just prepare yourself that most likely you're going to have to get an IV. Even if we don't have it hooked up to fluids running, the healthcare staff, the doctor is going to strongly encourage you to have an IV just in case we need one for emergency medication administration, and just to keep you hydrated during your labor, since we pretty much starve you once you get there. Now my personal beliefs on that, I'm a little different. I'm very holistic minded when it comes to just medicine and medical interventions. I'm very hands-off. I'm very pro, you know, the body, and that it's designed can do what it needs to do. But I do understand that there are, you know, small chances, there are times, which are the minority, when, you know, sometimes you need interventions. But I pretty much sway on the side of, you know, the less we do, the better. But I'm just letting you know, as a nurse, as a labor and delivery nurse, what the routine is when you get to the hospital. Another thing that I wish people knew or considered was take a tour of the facility if you're able to prior, so that you can know what your hospital offers. Some hospitals offer rooming in, which means like pretty much no separation of mom and babies. Some hospitals will, you know, after an hour, they take your baby to the nursery, and then they'll bring the baby back to you. So you want to know what that hospital's policy is on, you know, what's the plan after you deliver your baby. Also, if you want to exclusively breastfeed, some hospitals are breastfeeding friendly, or baby friendly they call it, and they're very, very supportive of breastfeeding. Others, you know, they may not offer that rooming in all the time, which makes it more difficult when it comes to exclusively breastfeeding. So I definitely say try and just, if you can, check out the facility and their policies and procedures before you decide to have your baby there. Another thing I wish people knew, look into the medications, the common medications that are given, which are erythromycin. We put that into the eyes of the newborns, and it helps prevent infections caused by gonorrhea. I believe it's gonorrhea and chlamydia. It's one of those. But you know, we put that as a precaution, but a lot of times the parents are like, what's that for? So I just always say, do your research. Know the common medications that are going to be offered to you, so that you can come in having an idea and not having to just rely solely on the word of your healthcare providers, which healthcare providers do have your best interest at heart. However, it's always good to be educated so that you can make what you feel is the best decision for you and your family. So look up erythromycin, look up the hepatitis vaccine. That's another one that's going to be suggested for you, your baby to get within, normally it's the first 12 hours of birth. And to look into the vitamin K shot. They give vitamin K because babies, when they're first born, they don't clot very well. So we give the vitamin K to try and help the body to form what it needs to be able to form a clot. So just look up these things so that you're familiar, and that when, you know, the nurse is asking you, are you okay with these things? You're not like, well, what is that? What is it for? You're not just completely clueless and you feel like you just have to rely solely on, you know, what your nurse or what your doctor is telling you about it. You'll have an idea and you can have already developed a level of comfort with what you decide to do. Another thing that I would say, breastfeeding. One of the most common things that I hear after people have the baby is, oh, I don't have any milk. I do not have any milk. There's no milk. I think the baby's hungry. It's okay. After you first deliver your baby, if you don't see milk coming out of your breast, you're not able to hand express any milk, don't worry. The best thing that you can do if your plan is to breastfeed your baby is to still try and put the baby on the breast, and put the baby on the breast as frequently as the baby requests. Definitely every 2 to 3 hours you're going to be trying to nurse your baby, and even more if the baby is showing signs that it wants the breast. So just work with your nurse, your lactation consultant, to help you with these things. But the more you put the baby on, the more frequently, it's going to help your milk to come in. So don't worry. That's like one of the biggest questions that I get is, I'm worried that I don't have the milk. I'm worried that my baby is hungry. Don't worry. In the beginning, you might not have a lot. You might not see anything at all. But the more you put the baby on, it's going to help your milk to come in. And remember, we're going to be keeping a watch on your baby, monitoring your baby. We're going to teach you the signs that you need to know to care for your baby before you leave the hospital. So just follow the routine. For most people, it works just fine. And in the event that you're one of those few, that rare few that has issues with breastfeeding or producing milk, well, you know what? Thank God we have alternatives. We have formula. We have different things that you can use to supplement your baby. And under the care of your doctor, your pediatrician, your baby is going to be taken care of. So don't fret. Trust the process. Another thing, that was kind of like a little bit of a tangent, but another thing to expect, to think about when you get to labor and delivery, would definitely be medications. Be familiar with medications that they use to induce and to augment labor. A lot of times women come in to be induced and they have no idea, no clue what the induction process is like. So there's medication called Cytotec, there's medication called Cervidil. These are two common ones that they use to start your induction. These medications go into the vagina. The process of putting them in the vagina is a little uncomfortable. So I would say that's one thing that really catches women off guard, are the vaginal exams, and some of the medications, the administration through the vagina can feel very invasive. So I would just say maybe look up those medications, look up the process of what it takes to begin an induction, so that you are just not blindsided when you come. At least you can begin to prepare your mind for what the process is going to be. And then Pitocin is another medication that we use to induce and augment labor. So definitely be familiar with that, because those medications may come across while you are in labor. Be familiar with your options for pain management. Sometimes people come in and they have absolutely like no clue what they want to do. So just be thinking about it. There's always natural pain management techniques and therapies, breathing, relaxation, movement, birthing balls, things like that. Your facility may offer nitrous oxide, which is like a more mild form of pain medication that you can use. There's pain medication in your IV, and there's the epidural, which is the basically they put a catheter into your back and it gives you medication throughout your labor to help take away the pain. So just be familiar with those things, because when the doctor comes in, they move pretty fast. When anesthesia comes in, they move pretty fast. And you know, it would be nice if they had more time to spend with the patients, but the fact of the matter is a lot of them are busy. They're seeing multiple patients. If they may be working out of multiple hospitals and they have to go from one hospital to the next, OBGYNs are very busy. So you just, as much as you can prepare yourself and have a familiarity with the process and what is going to happen, you can basically expedite, you know, time. You not expedite time, but you can make better use of your time, so that when the doctors come, you're not just completely like lost of the process. You can formulate a question because you kind of have an idea of what is going to happen. So yeah, I mean, there's so much. This is just a super quick video, so I was thinking of some things off of the top of the head. But if y'all have any questions, if y'all want me to make any more content just about my experience being a labor and delivery nurse, what to expect, definitely please feel free to leave it in the comments below. And if you like this video, please give me a thumbs up and subscribe, and I will be back to talk with y'all later. So I hope you have a wonderful rest of your day. God bless.